Soaring High, Crossing Boundaries, where we talk anything about nursing. Right here, Rapid Response with John. Good morning, Philippines! Kaya pala wala akong naririnig, naka-off pala yung mic ko. My God. How's everybody? Kumusta po kayo lahat? Today is January 11 ba ngayon? Nag-start ng live. Hindi ko alam yung date. Sabi ko, oh my God, mag-live ako. So anyway, today is January 11, I guess. January 11. 11 days na tayo. Patapos yung 11 days ng 2025. Naninibago pa rin ako sa aking setup kasi I have a brand new monitor. O, di ba? Ang taray. Bumili rin ako ng monitor para dito. Na-miss ko to, guys. I miss everybody. I miss doing this. Anyway, ilan nanonood ngayon? Dalawa pa lang. Ano oras mo sa Pilipinas ngayon? I guess it's 10:25 in the morning in the Philippines. And it's January 12 in the Philippines, correct? Please correct me if I'm wrong. And today is January 11 here, my time zone. And it's 6:26 p.m. Big shout out to my cousins who celebrated their birthday a few days ago, to Cassandra and Candice. Hi! I'll be there after this. You have to blow your cake. Anyway, biglang live lang to because sabi ko, nag-promise ako, di ba? Nag-promise ako every Saturday, mag-stream ako every Saturday. So, what will happen? We will talk about colostomy today or tonight. So if you have any questions or any concerns or anything about nursing that you want me to talk about, please drop a message and I'll try to squeeze in kung pwede kong mapasok sa aking oras ngayon, or if not, yun ang magiging topic natin next Saturday. Nagpapabati. Hello to, na Roldan. Hello. Hello to Roldan. Hindi yung Roldan na staff ko dati. A good friend of mine from Davao. Hey Roldan, kumusta? And of course, to all my students back in the Philippines. Hi everybody. I'll see you this coming Feb. Wala pa akong ticket, but rest assured I'll be in the Philippines this coming February. Most likely, first week or second week of Feb. And then magda-drop by tayo sa mga kasamahan natin sa pananampalataya. Na I'll drop by sa St. Louis Review Center. Big shout out to the CEO. And of course, Undersecretary of Department of Health, Dr. Roger Tongan. Hey sir, kumusta po? And of course, to our good friend from Cagayan de Oro City, Sir Gift Paguntalan. Kumusta na? Hello to Lian. Huy, kumusta ka na? Hi. Thanks for watching. And then, nadadaan din tayo ng Techno-Intellect. Oh, by the way, Sir Giff is the CEO, Director of Aim to Top Review Center in Cagayan de Oro City. And of course, big shout out to Director and the CEO of Techno-Intellect. Hello to Ma'am Amor de Lima. Ma'am, magdadrop by ako sa February. So, tingnan natin yung schedule kung makapag-lecture ako ng mga ilang araw lang dyan. Mga 2 or 3 days lang pwede kong maibigay. Max na yung 3 days. Diba? Kasi I need to fly back. The reason why I'm going home is to facilitate and attend the burial of my granny. Oh, ano daw. Uy, by the way, alam nyo ba yung nangyari sa Los Angeles, sa LA? Please help us pray sa mga nakatira sa LA. I heard there are about 200,000 of families affected and still counting, guys. My God, ano? Sabi nga nila, okay lang daw na manakawan, wag lang daw talaga masunugan. What's your comment about that? Big shout out, hello to J Love. Thanks for watching. And Kabuki You. Ang taray ng pangalan to. Thanks for watching, guys. Totoo ba yun na okay lang na manakawan ka, wag lang daw talaga masunugan? Kasi sabi na pag manakawan ka, at least may natira pa. Pero pag nasunugan ka, wala. Ubus lahat. Tama? Ako kung pwede walang sunog at hindi ako manakawan. Anyway, wala naman silang manakaw dito sa loob ng aking bahay. Meron mga mga soiled clothes. Nakawin nila tapos labahan nila. I don't have work today. Katatapos lang ng namin ng quarter. And I'm still finalizing the grades of my students. By the way, tapos na. Na-upload ko na. So, waiting na lang ako sa mga bagong schedule. Thanks for watching, guys. Anyway, yun nga, we will talk about colostomy in a bit. Nanganga pa ako. Hold on, let me share my screen and then we'll talk about ileostomy, colostomy, okay? If you have any questions or any concerns, please key in, type, and then I'll try to answer. Hello to Zeke Javier. Thanks for watching. Share screen. There. And by the way, big shout out to Diego Denver Aviles. Oy, kumusta na? Big shout out to you. And congratulations for passing the licensure examination. And hello to Tyron Ethan Cruz. Oy, kumusta ka? And hi to Mabel Ann Gigante. My God, na-miss ko kayo. Ang tagal kong hindi ginagawa to. And hello to Liwanag Morales Rubio. Thanks for watching. Anyway, so let's proceed. Gaya ng sinabi ko, we'll talk about ileostomy, colostomy. There are 3 common types of ostomies. Okay, this is actually a highlight in any qualifying examination, regardless if you're planning to take the NCLEX RN, NCLEX PN, or DHA Prometric, or even the local board examination in the Philippines. Ang dami ko nakikita ang questions na ganito at feedback ng mga student. Hey, Sir John, lubas yung sinabi mo about ostomy. That's good. Ang tanong, lumabas, ang tanong, nasagutan mo ba? So there are 3 common ostomies you have to consider: the colostomy, the ileostomy, and the urostomy. Okay, the colostomy, it's an artificial opening, bringing out a portion of your large intestine. So take note, colostomy is bringing out a portion of your large intestine. Ileostomy, on the other hand, bringing out a portion of your small intestine. Remember the ileum. Okay, and urostomy, on the other hand, that's for your genitourinary. Okay, so I will focus more on the colostomy and ileostomy. Sabi ni Tyron Ethan Cruz, hi sir, the best NCLEX instructor. Right. Thank you so much. Stop flattering me, but thank you. Taray. And of course, hello to Sheila Loman. Ma'am, ano na? Kumusta ni mga alahas natin? Ang tagal ko nang hindi nakapag-order. Order ako, promise, mga next week. Dapat may discount. Okay, so let's focus more on colostomy and ileostomy, okay? So I don't know if you can see my screen. So let's focus more on colostomy and ileostomy. I said your colostomy, it's bringing out a portion of your large intestine. That's your colostomy. Ileostomy is more on your small intestine. Okay? Now, things to remember about this. Bakit pa ginagawa yung ileostomy, colostomy? Bakit siya ginagawa? Paano ba ito mag-exit? Stop. There! So, usually ginagawa yung mga ileostomy, colostomy for several reasons. But isa sa mga common na rason is especially if your patient has cancer or patient sustained an injury in the intestine or intestine that requires rest in your bowel, rest in your intestine to promote healing or repair. Okay? So, an ileostomy, colostomy can be temporary or permanent. Naninibago ko lang sa aking camera. Ayun pala. So, an ileostomy, colostomy can be temporary or permanent. So, kailan ginagawa yung temporary, kailan ginagawa yung permanent. Now, remember I said that colostomy, either way, ileostomy, colostomy, there is bringing out the portion of your intestine. Okay? If the thing being brought there is your large intestine, that is your colostomy. If the thing being exposed and brought out on the surface is your small intestine, and that is your ileostomy. Okay? So, either way, bringing out a portion of your intestine. So, if the distal part cannot be used, okay? So, surgical remove yung distal part, hindi na pwedeng gamitin, then doctors will opt for permanent ostomy. Okay? If the distal part can be reused, okay, kailangan lang gawin yung ostomy procedure to promote repair, to promote healing of the intestine, at kailangan siyang i-reverse after that. Okay, after the repair, after the healing process, then doctors will opt to do temporary ostomy. Okay, I hope that's clear. So if the distal part cannot be used, we do permanent. If the distal intestine, the distal part can be reused, then we do temporary. Now, highlight in your examination, if the ostomy is permanent, okay, permanent ostomy, one common issue there is constriction of the stoma. Okay? So that is why isa sa mga tanong sa examination yan, what is one of your responsibility to prevent constriction of the stoma, especially to patient with permanent ostomy? One of the most important answer there is insert a finger into the stoma. Okay? Insert a finger into the stoma to prevent constriction. Hold on. May mga hello to Christian. Daming mga viewers natin ngayon ha. Hello to April Swanson. Na-miss nyo to ano? Hello to April Swanson, John Mark, Berwin Segudo, and hello to Chris Chu, Jules MH, Trish, Claveria Quinto. Thanks for watching. Again, if you have any questions, please drop a message. So, yun na. No? So, constriction. Sabi ko nga, no? Constriction. So, one nursing responsibility there is to insert a finger to prevent that issue for permanent. Okay? Now, isa sa mga common questions sa NCLEX yung mga when to empty the pouch, what is the size of the pouch, what is the normal characteristic of the stoma, yung mga ganun, no? Those are common questions na nai-encounter natin sa mga nursing qualifying examination. So what I'm going to do here, we will have a mnemonic for your colostomy, ileostomy. Okay? This is both for ileostomy, colostomy. Okay? The mnemonic there is actually colostomy. So wag niyong kalimutan to, no? Malaking tulong to if you will take the examination. Share and then whiteboard. Perfect. Ngayon pa talaga ako nag-arrange ng aking desk, okay? So, things to remember about ileostomy, colostomy, okay? So, our mnemonic here will be colostomy. Colostomy. Okay. So for colostomy, let's start with letter C. Don't forget for letter C, ano yung letter C? Color of the stoma. Okay, color of the stoma. Okay, question. What is the normal color of your stoma? The stoma must be dark red, beefy red, sometimes ginagamit na bright red. So those are normal characteristics. Those are normal color. So it could be dark red. It could be bright red. Or it could be beefy red. Okay, please, these are normal color of the stoma. If in your examination you will encounter bluish stoma or purplish stoma, those are abnormalities. Okay, so take note, the normal color, it could be dark red, bright red, or beefy red. Sometimes they will interchange this descriptions, pero normal po lahat yan. Okay, and take note, the stoma must be moist. If the stoma is dry, don't forget this. If the stoma is dry, it means to say that your patient is most likely experiencing from fluid volume deficit. Okay? Or in short, patient is dehydrated. Okay, hold on. May nag-message. Ano to? Thank you. Thank you daw, sabi ng aking pamangkin. Big shout out and congratulations to my niece for passing the, ano yun? Parang licensure examination ng accountancy, something like that. Pero certified public technician ba tawag doon? I'm sorry, Kay. But thank you so much and congratulations for passing that examination. So again, the stoma must be moist. Okay? Next is opening of the pouch. Letter O is the opening. Opening of the pouch. So what must be the size of the pouch? The size of the pouch depends on the stoma. Okay? Ang wag na wag kalimutan, the opening of the pouch must be at least 1/8 larger. Okay? It must be at least 1/8 larger. Larger than the stoma. Than the stoma. Hindi po pwede na ang opening ng pouch natin is maliit. Why? If the opening of the pouch is so small, what will happen? It causes irritation in the stoma. Okay? So it must be at least 1/8 larger than the stoma. Not too big, okay, and not too small. Okay, at least 1/8. What will happen if the opening of the pouch is too huge, too large? There is always a risk of what we call leakage. Okay, so that is why at least 1/8 larger. Okay, and L, don't forget this. Is it normal for you to have a liquid stool if you have ileostomy, colostomy? Guess what? Yes, initially. Okay, so take note, liquid stool is expected initially. Okay? So sometimes, sir, sabi sa amin kasi, sir, pag colostomy, dapat semi-form to form stool. Yes. Okay? But initially, liquid stool. Okay? And O stands for what? You need to observe for leakage. Observe for leakage. Now, what will happen pag hindi po maganda yung pag-secure natin ng pouch? Okay? Pag may leakage at continuous at saka hindi mo na-correct yan, that increases the risk of skin breakdown. Now, as a nurse, you need to identify the size of the pouch and what type of pouch being used. Meron tayong 1-piece at saka 2-piece. Okay? Don't worry. Pag makahanap ako ng mga pouch hospital, hindi ko naman sasabing na nakawin ko, pero I will just borrow and then i-present natin sa inyo. And S stands for skincare. Wag na wag kalimutan, do not apply oil. Do not use oil. Okay? Do not use oil. May mga nilalagay na po tayo mga barrier ngayon that will decrease the risk of skin breakdown. Not only skin breakdown, it will also decrease the risk of fungal infection. Okay? T stands for what? The consistency. Consistency. Okay? When you talk about consistency, I am referring to the stool. Okay? The consistency depends. Okay? On location, on the location. Okay, take note. Generally speaking, okay, generally speaking, if the type is colostomy, okay, colostomy, usually it is semi-formed, okay, to form stool. But if the site of colostomy is in your ascending colon, okay, if it is on the ascending colon, usually you will have a liquid stool. So bakit liquid stool usually pag nasa ascending colon? Kasi nga, yung effluent kagagaling lang sa small intestine. If the type is ileostomy, then you'll have liquid stool. Okay, so generally when you talk about colostomy, it's semi-formed to form stool, but if the dislocation of your colostomy is on the ascending colon area, usually it's liquid stool. For ileostomy, it's usually liquid stool. Now, having said that, pag yung pasyente natin may ileostomy at tinatanong what's the most appropriate nursing diagnosis, you can answer risk for what? Fluid volume deficit. Why fluid volume deficit? Because of liquid stool. Now, what about colostomy? Will you use fluid volume deficit or fluid volume excess? The correct answer is what? Fluid volume deficit. Sir, why fluid volume deficit? Eh, hindi naman siya liquid stool. Sabi mo nga, generally, it's semi-formed to form stool. Why fluid volume deficit? Remember, it is your large intestine in your anatomy and physiology. Okay, large intestine is the primary site of your what? Water reabsorption or water absorption. Okay, that is why if you have colostomy, it affects water absorption, putting you at risk for fluid volume deficit. Okay, don't forget that. And in your colostomy, mnemonic letter O, that's 1/2. 1/2 or 1/3 full. Ano yung 1/2 or 1/3 full? Empty the pouch. Okay, you don't have to wait for the pouch to be 100% full. Okay, you have to empty that if it's 1/2 or 1/3 full. Okay, and M stands for mucus. Okay, mucus is expected. So don't be surprised. Don't tell the doctor, hey doctor, okay, patient's colostomy drain, there is mucus, because that is expected. Remember, if it is expected, no need to notify the doctor. And Y stands for what? You need to avoid. You avoid, okay, foods, okay, that are considered what? Gas forming. Gas forming. Why? They increase odor. Okay? I hope that's clear. So these are mnemonics that I want to share, guys, about ileostomy, colostomy. Okay? So you have your colostomy, COLOSTOMY. You know their mnemonics, the relevance about ileostomy, colostomy. Okay? Hold on. There are things I need to share. Okay, now, highlights in your examination. Post-ileostomy colostomy, remember, in any type of general surgery or surgery in general, remember that you need to make sure that there is already return of your GI functioning, correct? Now, if it is not ileostomy colostomy, we always ask, were you able to pass gas? Tama? Sa mga pasyente natin. Okay? Nakautot na po ba tayo, ma'am? Diba? Tinatanong natin yan sa mga pasyente post-surgery. How will you know that the patient post-ileostomy colostomy was able to pass gas or was able to pass flatus or flatus? Tandaan, it's a pouch. So how will you know if the pouch is what? Inflated. Okay? So ibig sabihin, pag nag-inflate na yung pouch, ang laman nun utot na. Okay? So ibig sabihin, pag may lubas na utot sa pasyente, there is already return of bowel functioning. Okay? Next, another thing to remember in your exam. Remember, regardless of the type of ostomy, whether it's colostomy, ileostomy, okay? Tandaan, if you touch the stoma, pag hawakan mo yung stoma, normal ba na may increased sensation or decreased sensation? Let me know. What's your answer, guys? Is it normal for you to have an increased sensation or decreased sensation when you touch the stoma? The answer is decreased sensation. Okay? Don't be surprised na paghawakan mo yung stoma, okay, decrease yung sensation, wala ka masyadong maramdaman, wala kang ma-feel, namamanhid, gaya ng iniwang ka ng ano mo, namamanhid. Bakit? Okay? Decrease yung sensation due to decreased number of nerves, okay, sa ating membrane dun sa stoma. Kaya nga decrease yung sensation, normal po yon. Next, when you wipe the stoma, is it normal for you to see some blood streaks when you wipe the stoma? Yes or no? The answer is yes, normal po. But if you wipe the stoma and there's profuse bleeding, that's abnormality. Okay? That's abnormality. Now, what else? What else about ileostomy, colostomy? When you empty or drain the pouch, what is the best position? Best position is sitting, okay, position, para ka nagpupo, and you put the pouch in between your thighs, okay, and you drain whatever contents you have inside the pouch, okay? Don't forget that. Now, do you irrigate colostomy? Do you irrigate colostomy? The answer is yes. We irrigate colostomy. Do we irrigate ileostomy? It's a different question. Ileostomy, no need to irrigate because the effluent coming out is liquid form. Okay? So colostomy, yes. Ileostomy, no. Okay? I hope you learned something, guys. Yun lang siguro because I need to go to my cousin's house. We will celebrate. If you have any questions, please let me know, okay? Okay, please don't forget, we will do this every Saturdays. Okay, every Saturdays. Watch out again next Saturday. We will do this again. Please, if you want me to discuss a specific nursing concept, drop a message or send a private message to me. God bless everybody. Keep safe. I'll see you next Saturday.